Your heart is racing on Zepbound or Wegovy. That alone can feel like a warning sign. Most of the time, the cause is not what it feels like. It is dehydration, low food intake, or a body reacting to stress, not heart damage. The fear response moves faster than the facts, and acting on it before reading the pattern is the mistake. A fast heartbeat gets attention because it feels important. Sometimes that attention is warranted. Sometimes it is simply louder than usual. Many people make one of two bad moves. They stop the medication immediately, or they dismiss everything as anxiety. Both reactions skip the part that actually matters: judgment. Start with just two questions. Is the beat simply faster, or is it irregular? And what was happening before it started? I'm Dr. Kim. This is not medical advice. Consult your doctor. Here is how that picture usually develops. Medications like Zepbound and Wegovy change appetite, digestion, and blood sugar control. One major effect is slower gastric emptying. That means food leaves the stomach more slowly. Because food sits longer, many people eat less without noticing how much less. That matters because the heart reacts to the whole body, not just one medication. If fluid intake drops, blood volume can drop a little too. Then the body may raise heart rate to keep circulation steady enough. That is compensation, not proof that the heart is being injured. Here is the first payoff. A noticeable heartbeat on these medications often reflects body stress around the drug, not direct harm from the drug itself. That does not mean ignore it. It means the context decides the meaning. There is another layer most people miss. That is the control system for automatic jobs like heart rate, breathing, and digestion. If it shifts into a more alert state, your pulse can feel faster or stronger. Now start the judgment process with timing. Did it happen after a dose increase, a light meal, poor sleep, or a day with very little water? Those clues usually tell you more than one frightening moment on the couch. Next, separate fast from irregular. A fast but steady pulse is often explainable. One that skips or feels chaotic is a different category entirely. Irregular means it does not follow a steady rhythm. It may feel like skipping or fluttering. That distinction changes how seriously you should take it. Weight loss can change the experience too. As body weight drops, circulation, hydration balance, and body awareness can all shift. Some people are not developing a new dangerous problem. They are noticing a modest change much more clearly than before. And this is where the story bends. The mistake most people make is focusing only on the drug. They ignore what they are actually doing to their body while using it. The obvious explanation is often incomplete. The uncomfortable truth is this: sometimes the racing heart is less about the medication itself and more about how aggressively the person is trying to lose weight. They are eating too little, pushing through nausea, and sleeping badly. Coffee replaces water, and they call it discipline. The heart is not impressed by discipline when the rest of the body is running short. This matters for another reason. When intake falls too far, salt balance can shift too. Salt balance helps control the electrical signals that guide each heartbeat. That is why the body can feel jumpy before anything dramatic is found. That is also why stopping the medication does not always fix the symptom. If dehydration or underfueled eating was the real driver, the pounding may continue. Then people blame the wrong thing and learn the wrong lesson. Food timing matters as well. Very little protein and very little salt are part of it. Long gaps without eating make the body feel unstable. People often focus on the shot and ignore the schedule around it. This is why one dramatic moment is not the whole case. You are judging a symptom inside a body that may be tired, overstretched, and watching itself too closely. Now we can get to the detail I held back. What actually matters is not whether the heart feels fast once. What matters is whether the pattern is stable, explainable, and symptom light, or unstable, unexplained, and symptom heavy. Stable and explainable usually means you can identify a trigger. Maybe the dose went up. Maybe you ate very little. Maybe you were dehydrated. Maybe it happens after climbing stairs, after nausea, or after a rough night of sleep. That pattern is uncomfortable, but easier to interpret. It may still deserve discussion, but it does not sound the same as a rhythm problem. This is the part many people skip because it is less dramatic than the symptom itself. Numbers can help, but numbers alone can also mislead. A mild rise in pulse is not the same as a dangerous rhythm. One surprising reading on a watch does not settle the question either. Pattern beats panic almost every time. Unstable and unexplained is different. It shows up at rest, feels irregular, lasts longer than expected, or keeps happening without a clear trigger. Then the question changes. Could this be an arrhythmia or another medical problem? Now we are at the practical part. What should push you toward getting checked sooner? A heartbeat that feels irregular, a fast pulse that stays elevated at rest, dizziness, fainting, chest pain, shortness of breath, or a clear sense that something is off. Those warning signs matter even more if they are new for you. They also matter more if the rhythm feels chaotic rather than simply fast. That is the sort of detail that changes this from observation to evaluation. What usually supports watchful continuation and follow-up? A mild increase that is predictable, tied to dose changes or poor intake, and not paired with alarming symptoms. That still deserves a conversation with your clinician, just not an urgent one. Research suggests these drugs can raise resting heart rate a little in some people, though the increase is usually modest. What matters more is the company it keeps. Fast plus dizzy is different from fast alone. Fast plus chest pain is different from fast after a stressful morning and too little water. This is also where medical history matters. A person with prior rhythm problems, thyroid disease, stimulant use, or heavy caffeine intake does not start from the same place. Zepbound and Wegovy may share the headline, but the body loves side characters, and yes, the side characters often steal the scene. A simple log can help the judgment process. Notice the timing, what you ate, how much you drank, whether you slept poorly, and whether the beat felt fast or irregular. That pattern history is often more useful than one frightened guess. And here is the practical filter. If the pattern is brief, explainable, and otherwise quiet, the body may simply be adjusting. If the pattern is persistent, irregular, or symptom-heavy, that deserves medical evaluation. If you are unsure which category fits, uncertainty itself is a reason to check. A racing heart on Zepbound or Wegovy is not one thing. Sometimes it reflects less food, less fluid, or a recent dose change. Sometimes it points to a broader issue that needs attention. The smart move is not panic and not denial. It is pattern recognition. Remember this line. A fast heartbeat matters less than the story around it. With a stable pattern and light symptoms, the explanation is often less dramatic than it feels. With an irregular pattern or heavier symptoms, take it seriously and get checked. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.